to the 13th edition of the Tiny Lab Talks. We are going to talk about eHealth and design today. Tiny Lab Talks are brief informal talks between researchers invited by the University of Aveiro and researchers from the University of Aveiro itself through the American Corner program on topics such as technologies, innovation, research and culture. The conversations will usually take place here at the American Corner Media Lab with the support of the US Embassy in Porto, in Lisbon. I would like to give a warm welcome to both our guests, José Colucci and Margarida Almeida. I'll start with José Colucci. José Colucci is the Director of Research and Development at the Design Institute for Health, a collaboration between Dell Medical School and the College of Fine Arts at the University of Texas in Austin. Before that, José was a Senior Director and Associated Partner at IDEO, one of the most prominent design and innovation firms in the world. Margarida Almeida is an Assistant Professor at the Department of Communication and Art here at the University of Aveiro. Margarida is also the Vice Coordinator of the Digital Media and Interaction Research Center, Digimedia, where she also coordinates the eHealth and Wellbeing Research Group. And I'm Nuno Ribeiro. I'm a researcher at Ipatimup and através at the University of Porto and a research collaborator here at Digimedia in the University of Aveiro. Welcome to both.
Thank you.
And I'll start this tiny talk with a question for both. We are going to talk about technology and design and how this might affect how we interact with each other. So the first question is, can technology and design help humanize the doctor-patient relationship, for instance, or other aspects of healthcare systems?
Margarida?
No, you too.
Okay, so technology certainly has the potential to humanize the relationships between doctor and patient, between people in general. It has failed so far.
Yeah.
So anyone who has gone to a doctor recently, and that includes all of us, will notice that because of electronic medical records and other ways of capturing patient information that are require the use of a computer or a tablet, they are instead of an aid to diagnostics, they become almost an impediment to the relationship between the provider, doctor, nurses, and patients. But that it doesn't need to be that way. I think most of those systems have, number one, very poorly designed, and second, we are watching the beginning of a technology that has a lot of promise. It just hasn't realized its promise yet. So we are working on ways to make those systems better, actually making any data collection system better from the point of view of the human interaction. So one of my projects is what we call the exam room of the future. So we have a room equipped with sensors and sensing equipment, including voice, and it is AI driven. So we're going to listen to the conversation between doctor and patient using AI, and there will be an interpretation of that, and the AI will populate the medical records based on the patterns of the conversation. And in a way, it is sort of like a third person in the room listening to the conversation and capturing the important aspects. So this is just one example of what we can do with technology to humanize that relationship.
Mm-hmm. Yes, I agree that regarding the example of the personal health records, we have been failing, and there's a big problem in what regards the humanization of the interface design. But I also believe that we can do better, and I think that digital media are creating new opportunities for doctors and patients to relate in new settings that were traditional, not used to communication, namely in between consultations. And so I think that's an opportunity to humanize the relationship between doctors and patients, and we have some studies regarding the impact of messaging services in between consultations between doctors and patients, and we are understanding that there's a potential in that opening of the communication between them and humanizing healthcare. I also believe that literacy is an important point because we are all, I don't know if better or worse, but better informed regarding health. And as we have a new literacy paradigm developing, I believe that medicine is no longer so cold issue. So it's a better, there's an opportunity to humanize medicine and to open up the idea of healthcare. So I think we have to balance those points.
So, José, you were talking about a specific example of something that was brought up with human-centered design.
Yeah.
So, can you tell us a little bit more about how human-centered design works and give us one or two other examples?
Yeah,
of that?
It's a good question because it gives me the opportunity to talk a little bit about the importance of understanding humans.
Yeah.
To me, personally, human-centered design is what every design should be. Everything we see around us is touched by a human being and is designed for human beings. This glass, this table, the room here, everything is designed by humans for humans. So understanding deeply people's needs and aspirations is key to good design. And as incredible as it sounds, a lot of design in health and medicine has not benefited from this type of approach. A lot of hospital services we have, a lot of products are designed maybe from the point of view of the efficiency of a therapy, or even sometimes, if you want to be cynical, the efficiency of accounting. Yeah. Making sure that you collect all the money you can from the system, right? And that's obviously an approach that doesn't work for people. So, short definition, human design is good design. It's design based on real human needs, and for it, you require deep understanding of how humans behave. And we are not rational, as we all know.
Yeah.
So there's an art in that.
Certainly. Well, Margarida, pinpointing something that it's not located in the hospital, but outside the hospital. How can technology and design help in health promotion and disease prevention?
Now, for me, it's one of the most interesting phases of this new trend. I think that health promotion and disease prevention is benefiting very, very deeply from the new digital media paradigm. And if we compare the old traditional formats that we were used to use when developing health campaigns, like leaflets, traditional video, posters, and when we compare those materials with the ones that are used nowadays, we can see a very, very different impact on populations. Yeah. And I believe that it's because of the format itself, so it's well reported. The digital media impacts deeply populations because of its dynamics and the feedback, but also because of the social influence phenomena. This idea of the dissemination and the spread of the messages on social media, and how the social influence is impacting populations. And this is really, really an opportunity for us to prevent and promote health in a different manner. So I think it's one of the very, very positive phases, and we have to deep knowledge on that point.
Yeah, I agree. Well, José, the Design Institute for Health was created in 2015 with the ambitious goal of provoking every aspect of health systems to work better for people. I'm quoting. We can all agree that healthcare systems need to be improved, but do you think they are willing to change?
They had to. They may not be willing, but when you absolutely need change, change will happen. And it is better if you design that change rather than the circumstances design it for you. So what is the difference? I worked 17 years in design consultancy, IDEO, and I have been working for 4 years at the Design Institute for Health. And we have seen other industries benefit enormously from design. So you name it. You think the airspace industry, transportation, consumer goods, fashion, any industry that you think outside healthcare has benefited from design and sees design as a competitive advantage. Even in competitive here, should not be understood only in terms of money, but in the quality of the products we offer. And healthcare has traditionally been very impervious to good design. It's almost like this doesn't apply to us because healthcare is different, and we need to break that mindset and change the paradigm in healthcare. Healthcare services have a lot in common with consumer experiences, and they should be designed as consumer experiences because you as a patient, you are a consumer of a certain type of services that healthcare is offering. So why is it that when you go to a good restaurant or you go to a Starbucks store or you shop at Amazon, you expect a certain level of excellence in your service? Amazon almost guesses what you're thinking, what you're going to buy next, and they're always striving to make it to reduce the frictions in the system so that you buy what you want. Sometimes not always for good, but anyway, they do a good job for their objectives. How come we don't learn from these industries? How come we are in the prehistory of digital interactions in service design in healthcare? So we need to change that. We need to bring a different mindset to healthcare. And I think in the US healthcare system has a number of problems that everyone is aware of, but slowly design is permeating the system and people are understanding the importance of good design. So Dell Medical School, just to summarize this, is an example. The new dean of the school brought us and gave us the privilege of starting a completely new institute at the school dedicated to designing health because he saw the importance of educating a new generation of physicians in health and to bring together all the disciplines. We are also part of the College of Fine Arts. We bring designers and doctors and nurses to work together on challenges in healthcare.
Yeah, it's very, very interesting. Margarida, focusing on a special type of device, mobile devices. Mobile devices have revolutionized how we communicate, how we work, how we spend our free time also. Do you think they can revolutionize how we deal with our health?
They are already doing that.
Yeah.
It's interesting to notice not only smartphones and mobile devices, but other devices with IoT. We are moving to a new scenario in which devices are with us. And that's one of the important points on that issue, because the mobile device is almost a part of me and a part of my body, and it's been used to monitor my health condition. And it's also interesting to notice that until some time ago it was mainly to monitor my physical condition, number of steps, my heartbeat, and so on. And then in the last years it's moving to mental health, to mindfulness, meditation applications and solutions, and that's an interesting movement that must be better understood. This idea that I can monitor and take care of my health, not only considering my body and of course the sensors that exist in the mobile phone are very helpful to monitor my physical condition, but also to move to this mental health trend that we are living today, and that's very, very interesting. I believe that we need more evidence, scientific studies, to understand how can these devices, not only the mobile phones but other devices, help us with that awareness on my health condition. And I think that one of the most important things to study as the user, considering that it has multiple layers, and because we have different kind of eHealth users. We have the early adopters, we have the experts, we have the skeptics, and we have to understand these different users on healthcare And we have, most important for me to understand that those different users can be in one person. I can be an early adopter of a specific health solution, but I can be profoundly skeptic of another. And it's me. So the persona must be, I think, rethinked, because the healthcare is really an interesting scenario to understand that the user as users inside of the condition. So I think mobile phones are really an interesting platform to deepen knowledge and to collect more data to understand how can we use devices and how can the devices help us to better understand our health. Yes.
Yeah. Probably technology will continue evolving and will tackle different problems in different ways.
Yes, and because of the things that José was discussing relating the new consumer, we are also consumers in a different way. We are not only consuming information, we are modifying information, the idea of the prosumer, the one that consumes some information but modifies it and then spreads a different message and uses the information in a different way and influences the others, and also the idea of involving the different stakeholders. Okay, as José was saying that they do in the Dell Institute, the idea of working with the industry, with the health professionals, and also with the caregivers, and all the other stakeholders. That's really important to better understand and to develop evidence-based studies.
And we are in our last question. 20 minutes pass flying. How do you envision healthcare in the future, considering the potential role of digital media? And the question is for both, obviously.
I don't know what healthcare is going to be in 5, 10, or 15 years, because I don't have a crystal ball. Yeah. But I can guarantee you one thing is going to be different. Right? And change is one constant in our world. And someone said, I forgot the author, excuse me for that, but someone said the best way to predict the future is to invent it. Mm-hmm. And we are trying to invent the future of healthcare, because it is going to change in spite of us. If we don't do anything, the system will collapse. Mm-hmm. For a number of reasons, for reasons of cost, for reasons of demography. Think cost in US is out of proportion with anything. Portugal still has the costs under control in healthcare, which is not true of all European countries. But population is not under control. Population is aging very quickly. Aging is a good correlate for a lot of conditions, some of which are chronic, like diabetes, metabolic syndrome, etc., which increases costs and require a different type of care, for which we're not prepared. So my short answer is going to be different. Hopefully design and technology will make it better.
Different, hopefully
different
better.
And better.
Yeah.
Well, I'm not a healthcare expert, I'm a digital media expert. So as a digital media expert, I would like to work closer to healthcare professionals to help them to go in this new trend. I think that doctors are in a quite new challenge, not only because of Dr. Google, but also because of the new patient. It's not only the platforms and the information that is going online, but is also the new patient that comes into the consultation setting and brings a lot of expertise and questions and an attitude, a different attitude towards medicine and towards the idea of the expert, of the doctor. We've been developing some studies that have been showing us that patients still rely on the doctor opinion when comparing with what they collect online. So the ultimate decision is with the doctor. Despite the information that they collect online, the role of the doctor is not to replace for a huge percentage of our patients that we are inquiring. So I believe that healthcare needs to work closer with digital media experts, and that's what I would like to do in the future, and to collaborate and help to better understand this scenario.
There's an interesting book whose title says a lot. It says, "Doctor, the patient is ready for you," instead of the opposite. Okay,
Yeah.
the patient, the doctor is ready for you. Okay. We are turning the tables on that sort of dynamic.
That's a good a good
Yeah.
way of looking to the future.
And also, can we?
Yeah.
No.
Yeah, yeah. No.
We can. Thank you.
Just one.
And also the idea of the doctor as also as a human and as a user. We know that doctors are burning out with overload, not only of professional hours, but also because of IT and digital media and all the digital solutions that we are developing for them. So the doctor as a user and as a potential user that will drop out. So dropouts are really a problem. Not only dropouts from the users that are patients, but from the users that are doctors. And when we go and talk to a doctor and present an idea of a digital solution, the first thing is no. I'm in an overload of information. I have to use 20 solutions. I don't want another one. So this is also a challenge. The doctor is a person and it's burning out.
There's a list of major causes of burnouts in doctors. Number 1 is electronic medical records.
Of course.
Yeah.
Number 2 is excessive documentation, which turns out to be the same as number 1.
Yeah.
So those two factors, or this one single factor, is responsible for more than 70% of the burnouts in doctors. So we need to do something. You cannot add more work to that sort of routine.
And the best technology is the technology that is not
Invisible.
So
Yeah,
we have to
absolutely.
work in
Not
that
annoying.
sense.
Transparent.
Transparent.
Technology should not be a layer between you
Yeah.
and other people.
Should
It
be
should be
transparent.
something that enhances it.
Yeah. Thank you both
Thank you.
for
Thank you.
participating. We also thank the support of the US Embassy in Lisbon for this super possibility. The next Tiny Talk will take place soon, so stay tuned to our social media networks and don't forget to attend. Thank you for coming and viewing another Tiny Talk here at the University of Aveiro, Portugal.
Thank you, Nuno.